isn't, frankly, the first choice for this particular situation. The wipeability, the infection control issues are very valuable, and those helped us get the whole thing accepted. Infection control is one of the issues. It gets a tick in the box for that, undoubtedly. But it's not currently, in that incarnation, it's not the horse for every cause in terms of mobile use. And there are some cases where the real keyboard is preferred also, undoubtedly. Okay. And then down the bottom, to err is human, you can't design the possibilities of junior doctors finding ways around your safety process. And you have constant struggles of training issues. Indeed, actually, we have our current Act, having done most of the requesting, is to actually put in faster discharge summary production, exactly the same drivers as many other trusts that are trying to modernise that process at the moment. But only this week we had a small revolt on the wards. We're also a teaching hospital, as many are. Our SHOs are also there to be taught, as well as to do medicine and treat patients and use IT. And they complained they were spending too much time writing discharge summaries. They were not getting enough time to have their training. And the consultants who took their side said, right, that's it, we're going to cut back severely on the time they're going to spend with this equipment. So we have to find ways to square that circle. We'd like we can find ways that will improve their life and allow us to continue to comply with the NHS contract and not lose the revenue, which our commissioners would dearly like to stop paying to us. But it's a tricky combination at the moment. Obviously, but it can't be said too often, it is a team issue. It is about working across departments. It is about the relations between departments. I did go to a local hospital where the IT department were barely on speaking terms with colleagues in other diagnostic IT areas of the trust. Those relationships are absolutely critical. We had our clinical director of diagnostic services, Dr. Hooper, was our driver, and we had that thing which everyone says you've got to have a stakeholder who believes in it, who's prepared to put in some muscle and apply some persuasion where needed. And that's been vital. Having said that, he's now moved on to concern himself with other things, and we haven't quite finished our project, so we're looking around for more stakeholders to help us through the final stages. MCAs, I think I've made my point upon that. They've got much more robust, but the learning curve has been quite painful and expensive. Due to say that's the price you pay for being kind of leading edge, I'm afraid. And I think it's always well to be aware that there is such a risk. Wireless itself, I was talking to somebody in the exhibition who said that she might be able to help us. That's taken quite a while to get sorted too, actually. A lot of time. And we're still not totally there, to be frank about it. On the other hand, MCAs are certainly part of the landscape, but they're part of a mixed landscape, and mobile devices are going to come in multiple flavours, clearly, from iPhones and BlackBerries, which are quite popular, to clearly certainly netbooks, certainly computers on wheels, phone things, and certainly a place for the MCA. Thank you. So
how did you finally resolve the pediatric robot issue?
It's ongoing. It's still ongoing. We are not very sanguine about getting a different version of that container from another supplier at the moment. We think that a small container and a smaller label might be doable at the moment. It's a bit cut and dry because a smaller legible label that's got all the essential information about a microbiology request, which can be more than a few words, it's a bit on the edge, but we're hopeful that's going to be the solution. If anyone's got a solution that we don't know about, I'd like to hear about it.
For the outpatients, can you use the patient's letter with the barcode on to read the barcode to print the labels off?
Well, that's a good question. there's a lot of demand for barcode readers. In fact, we placed an order for 100 of them recently, the simpler ones that read them one-dimensional. For a number of uses also in theatres and for scanning things, items of supply also, as well as for identifying people. Yes, you certainly can scan. You could also scanning the patient, the barcode on the patient notes, which we have, like most people, is another useful step. There isn't thought to be generally a proxy for something which is in a reasonably secure way sort of inseparable from the patient, and that's why the wristband is the preferred thing to scan. In the case of the children, we talked about, what about a badge, for instance, a bit less invasive, it sort of sits on here. We experimented with the idea of having little kind of smiley faces and things on the wristband to make it a bit more human as well, rather than something that would be alarming. We think we've got over that. We think that for the paediatrics, the wristband is okay. Adult patients have responded, by the way, very well to it. It's not mandatory. We're not compelled to barcode patients. Our people decided they wanted to have the same level of ID security for outpatients as for their inpatient. It's not obligatory. There was a concern that they wouldn't like it, and we did a survey accompanying the initial deployment, which got nice results and feedback saying, I'm pleased rather than annoyed that you're taking extra trouble to make sure that you know who I am. Usually that's been fairly well tolerated. But I agree with you, there are other ways in which you can use the scanner, and that could speed up. Yeah. Yes. That's something that we're discussing in terms of things like sputum containers that patients take away with them and bring back later. I'm not sure we've cracked that yet perfectly. We don't have patients labelling, of course, in the inpatient setting, doing their own labelling. That's done entirely by someone who's been trained how to do it. It is a risk factor, undoubtedly.
There is writing on a blood line, and where you can just put a label on there and you're done. And finally we got that to accept. But it was a lot.
I should have mentioned also that when I say we've covered all you're requesting, we've covered all you're requesting for haematology, biochemistry, microbiology, BT, but unfortunately not for histology and cytology, because the size and complexity of those requests is not currently supported by the requesting product that we're using. We're hoping yet that's going to be covered, but that's a gap at the moment. And that means that we're not live for requesting in theatres because histology is such a big part of what they request from there. So still a few things to do.